All right, guys, I thought I would just real quickly do a Facebook Live for one reason, because I didn't get to do one last week. I took the entire office to Las Vegas for a team building and a little conference, and so I didn't do a Facebook Live. So I figured I would do one real quick. This is Netter, and if you watched one of my previous videos, you got to see I actually showed some illustrations from Netter that were from the book I used in medical school back in 1992, and that book is actually in pretty good shape. Anyway, this is a newer, well, I don't know how much newer because the guy died a long time ago, but it's republished or whatever. It's reworked Netter. But this is a specialty Netter. This Netter covers the nervous system specifically, whereas the other Netter covers the whole body. And the other Netter was really good, but this one specifically covers the nervous system. And there's Frank. I don't know if you guys get to see that other. This one's a little more conservative. The other one's hilarious. He's like kicking back with a cigar. I love that picture in my other Netter book. I have to show that again sometime. But anyway, this one goes through and really talks about the anatomy in detail. So I'm excited to be able to share this anatomy with you. A lot of people really seem to enjoy when I share these details with them. It's always sometimes easier for some people to understand with the more detail that you have. I realize that some of this is cranial nerves and sinuses and the parts of the brain. So I am an orthopedic spine surgeon, although I knew my head and neck anatomy quite well and still know it very well because I have to dissect through people's necks in order to do their neck surgery. But it has the very excellent illustrations of the spinal tracts and the cranial nerves. And so those are interesting. We can even talk about something like Bell's palsy sometime, or maybe some sort of more central nervous issue. But this also contains information regarding the spinal cord. And here's that picture, very similar to that other picture that we once looked at, showing the spinal nerves as they exit between the lateral masses, and even shows some of the muscles that are being innervated. Again, I'm just kind of showing you. Really, this is showcasing off Netter's amazing. This is an MD who lived many years ago. I think he probably died. I don't remember. I'd have to go back and look. But, he was in the middle of last century, and he was incredibly talented and could draw any anatomical part. And, of course, he had to do this from looking at either the drawings or actual cadavers. But he is considered the Picasso, for sure, of these anatomical drawings. And it's really cool because he'll go through and break down just the vascular system like he's doing here, showing the vertebral artery going up to the brain, or he'll show this amazing view of the vascularity of the spinal cord itself and how the nerve roots actually connect to the spinal cord. Here's some of the venous system in the bone, showing where the veins are, how they're in the epidural space. They're surrounding the spinal cord. We run into these a lot when we're operating. This is really what causes most surgeries to really bleed. You've got to try to do your best to control that bleeding. This is showing the spinal thalamic tract, which are really, this is really into spinal thalamic. There's all kinds of different tracts that are motor tracts, that are sensory tracts, that are tracts that perceive pain, perceive vibration, etc. You can even talk about that sometimes if people really want to. That's really getting in the weeds, though. Kind of like making you a neurologist or a neurosurgeon or a spine surgeon, I suppose. Completely unnecessary, but very interesting to see how these tracks cross. It's called decussation, where they actually go from one side of the spinal cord to the other. So having an injury to one side of the brain can actually affect, depending on the tract, the opposite side of the body or the same side of the body, depending on specifically what tract we're talking about. And we can see these tracks here. It's kind of cool the way he drew the fingers and the face on the surface of the brain, kind of a brain map, if you will. There's one you can read. There's some brain mapping, if you will. Another example of some brain mapping. Anyway, Netter was amazing, and this will be probably from now on my go-to book if I want to show you guys something. And so here we have the posterior root. So this is showing the ganglion. I've never really broken down the nerve roots for you, but they really aren't just as simple as a nerve trunk, single, electrical cable coming off a larger electrical cable. It's actually a lot more complicated than that. There's something called the posterior ganglion. There's the anterior root of the nerve root, etc. Anyway, but we can talk about that. You know, one portion contains the motor axons, one contains the sensory axons, etc. And then, of course, reflex arcs also pass through at those levels. And then, you know, that's where you get your reflexes when the doctor hits your knee with a hammer. We could always talk about that sometime if you want. Goes through and really talks about the levels. Like if someone were to have a injury at, say, I believe Christopher Reeve was C3-4 or 4-5. I think he was 3-4. I can't remember. I have to go back, but it's very high. So this shows you all the downstream effects. And so, for instance, you had in a patient who is born with a defective spinal cord. Some people call it spina bifida. That's not completely accurate, but anyway, yes, they have a defective spinal cord. They'll often have a level down in the lumbar spine, L3-O4. So everything below that level would be affected, and that's kind of what this is helping you understand, is what are the levels, what did they contribute, and what will be affected downstream from a lesion that occurs at a specific level, say L3-O4 or C6-7. This is a nice map showing the dermatomes. So this is just the sensory on the surface of the skin. We often, you know, the things that doctors memorize is that T4 is the nipples and T10 is the belly button. And so when you're basically taking a little, a needle, if you will, you're not stabbing them, but you're saying, do you feel this, do you feel this? When you're trying to determine the level, this is how you estimate that level. You would know that if the patient said, oh yeah, no, I can't feel anything, you know, 6 inches or 8 inches below my nipple, you would know that that level they have is somewhere between T4 and T10, probably something along the lines of C7. But that's how you would help map that out. And this is just for sensory. These are sensory dermatomes. These are also the ones that would be effective. Say, if you have a C6 pinched nerve, you might feel that numbness in that area. This is why C6 affects the thumb and the fingers. C7 affects the middle finger. And so, you know, in sciatica, S1 goes down the back of the leg, and L5 tends to go down the side of the leg. And this is what's felt, the numbness or the tingling or the pain that's felt in that dermatomal distribution because you're pinching a specific nerve. But all I'm doing really here is just going through and showing you the amazing artistry of Frank Netter, who is just, you know, nobody even knows he exists, but the guy was truly amazing. Here he showed this, he drew this example of a tumor. This is probably a neuroleoma. Yeah, it is a neuroleoma. And so that is a tumor that has basically grown around the nerve sheath and it's expanding. And so you can see here, it's showing compression of the spinal cord. So this is all tumor right up to here. That's the spinal cord sort of being shifted over to the opposing side. And this is all tumor right here. So anyway, and this is showing it when they open up the dura. You actually have to cut through the dura. Normally we try not to invade the dura, but in some cases you actually have to go through the dura to get a tumor out of the spinal cord. Anyway, just showing how, you know, this is great because this is a clinical book as well as showing illustrations. It's going to go through and show some really good illustrations, but at the same time describe these clinical syndromes such as cervical disc herniation, spondylosis, myelopathies, and then we get into the spinal trauma. Anyway, and then it's going to show some fractures, I'm sure. C1, C2, etc., burst fractures, and all that kind of stuff. So this will be real. I just got home from our trip, and this book was waiting for me. I've never owned this particular book. I own a lot of books, obviously. I've never owned this particular book. And so it's very exciting because I really love Frank Netter. There's one, we talked about anterior-cervical surgery recently, and this book would have been perfect for me to show how the plate and the graft goes on. Just real quickly, and if you remember, I actually showed video of me removing the disc material and exposing the spinal cord, decompressing at that one level. This is traction. I've certainly used this before, and unfortunately I've used this before, and I've used that before. Anyway, and I've done these before, posterior decompression, where you come in and you remove the bone, expose the spinal cord to get the pinch off. And if that patient hadn't gotten better, the one I did recently, if he had not gotten better, this probably would have been my next step to then go from the back, because he did have a little bit of pressure on the back as well. But because he's up and walking and doing fantastic, there's no reason to do more to him unless he needs it. And here's what that looks like on x-ray, putting those screws in from the back. Pretty pretty brutal. Anyway, this was intended just to be yes, I'm still here. Yes, I'm still doing Facebook Lives. I have not abandoned you, just been kind of busy. Just wanted to share this really great book with Netter's illustrations in it. And I will hopefully be using this in one of our next Facebook Lives to demonstrate the anatomy so you can have a good understanding of the structural anatomy and how it's affected, causing a spinal pathology. And don't worry, we're still going to be talking lots about nutrition and health and wellness as well. Anyway, you guys have a great day.